DigiTwins has the goal to solve one of our big remaining problems, the fact that medicine is in large parts not really personalized. We are all different, we have different genomes, we have different disease history, different environments, different behavior. So diseases are often different, so superficially similar. It is therefore not surprising that we respond very differently to the therapies or preventive steps which we take to get cured or to avoid disease. To change that, we have to switch to an approach which has been working in all other areas, except for medicine and drug development. In complex situations, we cannot avoid making mistakes, but in all other areas, we have switched to making our unavoidable mistakes safely, quickly, and cost-effectively on computer models of the reality. While in medicine, we still basically experiment with real patients and real clinical trials without filtering first obvious mistakes by this modeling step. So in the DigiTwins project, we would like to improve three major areas. On one hand, the diagnostics, which characterizes the individual patient through molecular techniques, through imaging, through sensors, and through many other technologies which we can still use in the future. We would like to increase the range of therapies which are available. You can only personalize a therapy if it has already been developed, for example, by working on techniques to redifferentiate cells of the individual patient into the tissues which are causing problems. And the most critical part, the prediction techniques which are able to select amongst the entire range of therapies or preventive steps or therapy combinations, the one which is optimal for the individual based on the deep characterization which we can carry out now of every individual and even more in the future. The technologies we have available have increased dramatically. We are now roughly 1 million-fold better at sequencing a human genome. The cost has dropped from $3.5 billion in the Human Genome Project to maybe $600 and are on the way to below $100. We have over maybe 20 years, 1 million-fold improvement in our computational resources. So we have in two critical areas of data and model-driven medicine of the future made enormous progress, which is going to drive the future of medicine, the future of healthcare, the future of prevention, but also the future of well-being, with every individual having his or her own personal model or set of models from before birth up to old age to protect them against potential mistakes in medical treatments, against mistakes in behavior, environmental exposures, but also allowing them to interact more intelligently with their own biology. If they, for example, want to run a marathon, they could train to see with their own model which training schedule, which food is optimal for them. So it's a very general approach, which obviously can not only save us from disastrous consequences of medical treatments which have gone wrong, but can also generally revolutionize our lives.